to decrease his risk of completion. He already have a suicidal thought, okay? Now, by advising the mother to lock away the firearm will reduce the chance of completions, because now he, once already have a thought, now it's all about the method, what's available. Is that clear, folks? That's the idea here, folks, okay? That's the key here. Now you could see, that's that. Let's try this one. You're going to fight between these two options. Agree? Now the question is, which of the following is the strongest risk factor for completed suicide? They didn't ask what's a method. Is that clear, folks? If they ask for the method, you could say access to firearms. But they're asking the strongest risk factor. That's a previous suicide attempt. Is everybody clear, folks? That's how they play with the question. You have to be careful here, okay? 49% and 43%. It's not the most common method, but the risk factor.
Dr. Roy, could you please show me the question ID of the previous question?
11618. "19-year-old man comes to the office for evaluation of hand injury. He says, I was just minding my own business at work when this dog bit me. The patient recently started operating a dog fighting club and adds his entrepreneurial skills have made him richer than a doctor. He has been fired from multiple jobs, most recently while working as a car salesman due to getting into argument with coworkers and being repeatedly late to shift. The patient says, I was only late few times. Haven't you ever been late before, doc? So during the middle school, he was recurrently thrown and spent time in detention center for problem hit, tampering with the teacher's car. So he has a lot of involvement of criminality, and he was in a detention center and everything, right? So here you should be fighting between A and C. Okay, here you should be fighting A and C, folks. Why are we seeing? Okay, now look at the age. He's 18 and above, so that's antisocial. If the same thing that happens less than 15, then you go for conduct disorder. Is everybody clear, folks? So whoever has conduct disorder, they become antisocial. Basically, he's destroying property and car and stuff, right? So that's the idea here. Right. So that's that, folks. Clear here? When you see these kind of people, what do you want to do? You want to run away from them, isn't it, folks? So public avoids them. Agree? That's a schizotypical personality disorder here, folks. Okay. So she believes in things that doesn't make logical sense, folks. All right. "22-year-old woman is hospitalized due to suicidal ideation. The patient described feeling of intense sadness, emptiness, and despair the past week following up a breakup of a 1-month-long romantic relationship." So you could see all the features starting here: interpersonal relationship, emptiness, and also suicide idea, right? So we have that. For the past week, she has had difficulty falling and staying asleep, and then she had no change in appetite, energy, or concentration. She feels betrayed by her boyfriend and is furious at her parents for turning against her. Since the breakup, the patient has been going to bars, engaging in unsafe sex, and drinking excessively. She described having intense mood swings since adolescence and has a history of 2 suicide attempts. When you see all these things, it should get you to, what is it? Borderline personality disorder, folks. This person is borderline: interpersonal relationships, short-term relationships, suicidal try, and then you have emptiness and everything, folks. Okay. Now, some people went to see it is not dependent on somebody. They didn't say they are dependent. And D, this is not attention seeking, histrionic. Okay. So this is borderline. And they could ask you another question: what defense mechanism do they use? Splitting, isn't it, folks? So splitting is the one. All right, very good. So that's that. 30-year-old man comes to the office for evaluation of discomfort in his wrist. He thinks his symptoms may be related to typing all day, every day. The patient is a software engineer and preferred to work remotely from home to avoid wasting time talking and interacting with coworkers. So he doesn't like to talk to people. He rarely leaves his apartment and spends his spare time on his computer, reading online forum about space exploration and possibility of alien life. Sounds like Elon Musk. Now here, when asked about relationship, he says, I have always liked being on my own. And he spent a large portion of his childhood disassembling and rebuilding electronic devices. So the question says that he likes to be himself. So that's a schizoid personality. Is that clear, folks? That he tried to be on his own and do that. That's his. He avoids public. All right. So that's that, folks. All right. Any questions so far? A 40-year-old woman is brought to the emergency department by her roommate due to significant left leg weakness. The symptom began 3 days ago after her father had a heart attack. So her father had a heart attack and then she started having symptoms. So anytime there's a stressful situation, it's affecting. So the dad having a heart attack is the stress. Is everybody clear, folks? All right. There is no personal or family history of neurological disease. Surgical history include liposuction of the thigh and varicose vein. Okay. Now there's nothing else. Physical exam reveals symmetric 2 plus deep tendon reflex as well as normal muscle bulk and tone bilaterally in the upper and lower extremity. Lab testing and neurological exam shows no abnormalities. So right now, if I ask you what symptom she only has the leg weakness, which is a neurological symptom. Is that clear, folks? This is a pure neurological symptom. I know some of you might think it's a somatic symptom disorder. Somatic symptom disorder, you have to have multiple symptoms like a nerve problem, abdominal pain, multiple problem. And here, after the dad's heart attack, she has this. That's a conversion disorder, folks, okay, after a stress. Now, why specifically conversion? Conversion is a neurological symptom. Lower leg weakness is a neurological symptom. Is that clear, folks? That's why it's conversion disorder. Of course, it's none of these things you could rule out, right? You will be fighting between B and F. Is everybody clear, folks? So narrow it down to is the best option. And here there will be more symptoms. Okay, see, that's the second highest. Everybody clear, folks? All right. Let's continue with the anxiety disorder. Okay. Now, talking about anxiety disorder, it's an inappropriate experience of fear or worry and their physical manifestation incongruent with the magnitude of the stress. So they're being nervous, anxiety, okay? Symptoms are not attributable to another medical condition, right? So they always, if you see, when you go to psychiatry, they order 2 types of tests, thyroid function test and urine toxicology, right? Because these are the 2 things that can influence a psychiatric problem. So we have to rule that out for substance use. This includes panic disorder, phobia, generalized anxiety disorder, and selective mutism. So anxiety disorder is a big word. like a mood disorder, that patient become anxious or nervousness about something. So the first, we're going to talk about panic disorder. Recurrent panic attacks are called panic disorder. When somebody gets multiple panic attacks, then we call it panic disorder, folks, okay? Now, attacks typically peak in 10 minutes with more than 4 of the following: palpitation, paresthesia, depersonalization, abdominal pain, nausea, intense fear of dying or intense fear of losing control, lightheadedness, chest pain, choking, and all these things. See, the best way to explain panic attack, the minute you feel that, that's it, you're going to die. That is what's called panic attack, folks, okay? You cannot feel it unless you experience that. So you feel like, okay, you have 2-3 seconds to live, that's it. That is panic attack, folks, okay? Now, strong genetic component is involved and increased risk of suicide, okay? These people cannot handle these panic attacks. Sometimes they just want to take their life, okay? Diagnosis requires attack followed by more than 1 month of the following symptoms, right? After one panic attack, you need to have this for 1 month. Persistent concern of additional attack. They worry about the other attack, worrying about consequence of the attack, and behavioral change related to the attack. They change themselves. Okay. Symptoms are systemic manifestation of fear. That's the key here. So we do treatment and some therapies, folks. Okay. That's panic disorder. So multiple panic attacks are called panic disorder. Then we have phobias, folks. Okay. Different type of phobia. There's a severe, persistent, more than 6 months fear or anxiety due to presence or anticipation of a specific object or situation. Person often recognizes fear as excessive, and that's a key, folks, okay? First one, social anxiety disorder, right? Exaggerated fear of embarrassment in social situation, public speaking. See, if you have to talk in front of 150 doctors, you will be very nervous, isn't it, folks? That's basically social anxiety disorder when it becomes too much and you cannot control it, okay? Some people have problem using public restroom, anything, right? Those things. Treatment, again, medication or help, folks, okay? That's the idea. A lot of people use beta blocker. Why beta blocker? So think about it. When you start talking in front of people, for an example, the problem, you get nervous because of the sympathetic system, you have increased heart rate, palpitation. The minute palpitation comes, that's what actually makes it worse because you cannot breathe, you cannot talk properly. So taking beta blocker, maintain your heart rate. When you are calm, it's much easier. Okay, that's that, folks. Agoraphobia, that's a irrational fear and anxiety while facing, anticipating more than 2 of the specific situation, right? Some people cannot handle open space or closed space, right? Some people cannot stand lines or being outside of home alone or public transportation. You just fear of space, that's all it is. Now, symptoms stem from the concern that can help or escape may be unavailable. When they know that, that's the issue, folks, okay? That's phobias. Next, generalized anxiety disorder. That's a high yield topic, 100% one question in your exam, okay? Now, let's talk about generalized anxiety disorder. If I were to tell, let's say I have a patient, the patient is worried about his education, okay? Worried about education. On the other hand, I have another patient, the patient is worried about her job, kids' education, her father's cancer. How many worry this one has? There's about 3 different types of worries, right? She worries about her job, worries about the kids' education, and worries about father's medical condition. Whereas here, this person only worried about one thing. Is everybody clear, folks? When we are worried about one thing, we call it just anxiety. We have anxiety. So when you are worried about your step 1 exam, you just have anxiety. That's it, because you're only worried about one thing. When people have worry about multiple things, which mean more than 2 things, we call that generalized anxiety disorder, folks. Generalized anxiety disorder should have more than 1 or 2 different types of worries. Look at this. Excessive anxiety or worry about different aspects of daily life. Work, school, children. You see how they have given it, folks. The recent NBME question, similar question. She worried about her kids' education, her husband's job, and then also worried about her father's medical condition. That's 3 different worry, folks. Okay. For most of the days for more than 6 months. That's important. It has to be more than 6 months. Because there's another disease we're going to talk about if it is less than 6 months. Okay. So that's more than 6 months. Associated with more than 3 of the following, folks. Okay. Difficulty concentrating, restlessness and irritability, muscle tension and fatigue, and sleep disturbed. Keep in mind, having anxiety is different, being depressed is different. There's no depression. This person is not sad at all, just the nervousness of handling. Is everybody clear, folks? So you should be able to differentiate. Anxiety people, not necessarily sad. Okay, that's the idea. So that's generalized anxiety disorder, folks. Next one, trichotillomania. Okay. So what's this medical condition? So this is the one when people become stressed, nervousness, they pull their own hair. Okay, now you could see that here. So patient comes with a patchy hair, more common in kids actually. Compulsively pulling out own hair causes significant distress and persists despite attempt to stop. Areas of thinning or baldness of any area of the body, most commonly the scalp. Okay, that's the idea. The incident highest in childhood, but span all ages, everything, folks. Treatment is psychotherapy. Okay, that's what it is for that. This is a high yield, these 2 topic, 100% one question in here. Okay. Now, this terminology, let's talk about what is adjustment disorder, folks. As the word explained, adjustment disorder means your lifestyle has changed, so you have to adjust to a new lifestyle, and that's making you stress. Is everybody clear, folks? Now, a good example, let's say a person, a couple, husband and wife who's been married for 40 years. Now they are divorced. Once they are divorced, this person has to go separate and start living in a different place. The whole lifestyle is changed. Everything has to be done by that person. See, that's called adjustment disorder. When something changed and that makes you stress. Emotional and behavioral symptom, anxiety, outburst that occurs within 3 months of an identifiable stress. Divorce and illness, right? Look at an illness. Let's say a big person, a rich man lives on a mansion, has servant and everything. Now all of a sudden that person has a cancer and they have to move it to hospice. And they're going to be life changed from a mansion to hospice care. Does that make sense, folks? That's called adjustment disorder when your lifestyle changes, okay? The thing is, it has to be less than 6 months. When the symptom goes for more than 6 months, we call that, what is it? Generalized anxiety disorder. We just talked about generalized anxiety disorder. We said it has to be more than 6 months, isn't it, folks? So this is why I like this time chart here. If you see here, this is beautiful. The same disease, less than 6 months, we call adjustment disorder. More than 6 months, we call generalized anxiety disorder. Okay, that's that. So that's the adjustment disorder. Okay, treatment, CBT, and medication can be used, but that's adjustment disorder. Is everybody clear, folks? Okay, it's stress and worry. Next, PTSD, post-traumatic stress disorder. What is PTSD? You experience something that causes very sad and distress, that's fine. But anytime you re-experience that event is what we call PTSD. Is everybody clear, folks? Only if you re-experience. See here, folks, experiencing, witnessing, or discovering that loved one has experienced a life-threatening situation, and that you need to re-experience of the event. That word is important, re-experience. Like let's say you something happened to you, but then if you never re-experience that, then you don't have PTSD. Is everybody clear, folks? Only if you re-experience, we call it PTSD, folks, okay? Now, in order to diagnose that, it has to be more than 1 month. So the PTSD must be going for more than a month. More than a month. If it is less than a month, what if I tell you that I have similar to PTSD, but it's less than a month? Acute stress disorder. Now, if you see the axis, it's right there. Same thing. Happen less than 30 days, acute stress. More than 30 days, PTSD. So the 30-day is the one that differentiates the name here, folks. Everybody clear? All right. So that's that. Okay. Okay. We'll do some questions later. So let's continue. So that'll take care of that. Let's go to this page. Again, high yield, eating disorder, 100% one question, minimum in here. Now, when it comes to eating disorder, most common in young women, the key first, anorexia nervosa. So what happened here, folks? These people have a fear of weight gain, okay? So that means not necessarily they are gaining, but they are imagining that they are gaining weight. Overvaluation of thinness and body image distortion leading to calorie restriction, severe weight loss, and look at their BMI. Less than 18.5. So that means that they wear like skin on top of the bone. That's it, right? So they're very low BMI. Main presence with hypothyroidism. Highlight the word. You cannot actually diagnose without amenorrhea. I mentioned this, right? Why do they have amenorrhea? Type it up. I wonder what the precise wording. Why on earth do people have amenorrhea? Something is getting disturbed. What is that disruption? So it's the HPO axis, but to be more specific, what does it do? Be more specific. Inhibit disruption of pulsatile GnRH secretion. That's where the problem starts. Okay.
It's just hypothyroidism. Hypothyroidism is associated with bullying.
No. So they're saying main presence with hypothyroidism, because what happens when the body loses so much of BMI, so the body slows down the BMI because they're losing, like your body can't slow down afterwards. So not because of this, because of anorexia, they might progress into hypothyroidism. Okay, so that's that. So then you have that. So that's where anorexia is. And there's the couple of types. Binge eating and type, which means recurrent urgent behavior. They either use laxative or diuretic self-induced vomiting and stuff. Okay, so they eat and then they go. Next was restricted type. Basically, they just don't eat. Include diet, fasting, over exercising, all those things. Okay,